Bone is actually a hard connective tissue. If you look at the way the body is created, you have what is called cells, then you have tissues, then you have organs, and then you have systems. But bone itself, as a structure, is actually a hard connective tissue. However, there are so many components of bone. The essential cells in the bone, human bone, are called the osteoblast and osteoclast. When a child is in the mother's womb in embryo, bone is mainly cartilage. The skeletal bones are mainly cartilage. But over time, they ossify. They have calcium deposit and appetite, so they become hard tissues when the baby is born. Now, the essential component of bone remodeling is that the osteoblast will lay down the bone. The osteoclast will remove the non-essential part of the bone. But that ability to regulate osteoclast activity is actually determined by genetics. And that's why you have a tall man, or you can have tall children, because the genes are going to modify the rate at which bone is formed and bone is remodeled. But beyond that, bone is not just a skeletal framework, contour. It's not only meant for the way we look, the way we are, we're made. But bottom line is that the bone also stores the very essential, ions. So many essential components for our existence that are stored in the bone. It's the major storage for calcium, for instance, and phosphate. And these are essential ions for human existence. But beyond that, you have a lot of all the muscles and tendons in the human body attached to them. So they allow you to move. So you have locomotion, you have the body figure, the core, the torso, the limbs, all of those things are dependent on the architecture and the makeup of the bone. So at various times of our lifetime, you have alterations and changes in the dynamics of bone formation and bone remodeling. So when you're younger, you tend to form more bone than you lose. Okay, at about the age of 35, 40, it's sort of equilibrates. So you have more or less you're forming and you're losing. But after the age of 45 or thereabout, you tend to lose more bone than you form. Therefore, the issues of life play a lot on you when you're over that age. So the concept of having low bone mineral density, low bone mineral content are probably not essential until you're over the age of 45 when you are well nourished. But of course, those who do not have enough, they don't have good nutrition, and they even at younger age, they may have problems with their bone. But let's take it that you're well nourished, and we expect that by the age of 35, 40, in this climate, in the African setting, you shouldn't have softening of your bone. But beyond that particular age, tendencies that have a lot of people becoming couch potatoes, got a little money with you, you don't want to exercise. You rather go from car, to your office. You walk less, and then you don't want to stay in the sun. You don't have enough vitamin D, which is essential for bone metabolism. So all of these things will play on you. That's why at that particular age group, people have softening of the bones. But unfortunately, as you get much older, after the age of 60, the risks of now having osteoporosis, which is a totally different disease entity, when you then have a lot of activity of the osteoclast, the bone, the cell that removes bone in terms of remodeling, becomes overactive because you have very little activity in bone formation. So bone is so critical for human existence. Like I said, not only because it provides the skeleton, attachment of muscles, protects very vital organs like the brain. It's a skull that protects the brain. It is the torso, the ribs that protect the heart and the lungs. It also has essential minerals, but very critical part of the bone, particularly the exoskeleton, is manufacture of red blood cells. So you see that you can do without many things, but you cannot do without a bone, technically, because we agree that all the organs in the body function together, but bone is a very essential component of human existence. Before now, what we're doing was to do plain radiographs, plain x-rays. We have what we call anecdotal evidences. Okay, someone comes with an unexplained bone pain, You look at the age. Well, this person is over the age of 60. You think, well, maybe the bones are softening. Then you do some biomedical, assays. You do some chemistry. You check the calcium, you check the phosphate, just to be sure that this, peptides or ions are working well. But unfortunately, they may suggest, but they won't give you an accurate diagnosis. But from my own understanding, at the point where osteoporosis is evident on bone, on plain X-rays, that bone is actually in danger. Meaning that we look for what you call stress marks. All right. If you look at the orientation of the collagen fibers and the bone, particularly around the neck of femur, they look like grooves. So you see them. Okay, they're called trabecular markings. You see them on bone, and then the quality and the quantity oftentimes is used as a predictor of whether the bone is just a little soft, osteomalacia, or the bone is osteoporotic, in which case there's a risk. So in osteoporosis, which is the extreme, the background of the particular patient is almost similar to the picture on the X-ray. Meaning, if you lie down to take an X-ray, you're looking at different densities. You're looking at air, you're looking at something that's going to be very high, that will look white. So calcium hydroxide is whitish, whereas air is dark. Now, by the time your bone is looking dark, it means that you hardly have enough calcium hydroxide. So that's osteoporosis. So if you wait until that time, that patient is actually in danger. All right. So plain X-rays do not give us the answers for any interventions. It won't give you interventions for osteomalacia or osteoporosis. And so using the biomedical markers to try and interpret what may be going on in the patient, sometimes a little bit difficult. Again, you find 3 areas in the body where we get worried about. A tall man at birth, maybe 6 feet, and then suddenly he's reducing in height. Of course, nobody has beaten him, or compressed him, but his spines are crumbling. So if you take an X-ray, you find that you have anterior wedge of the vertebral body, particularly in the thoracic region. These are signs that the bones are getting soft. But at that particular point, you are probably losing it. You don't have to wait to that point. Whereas, with the invention of the dual energy extractometer, the DEXA machine, you can comfortably make a diagnosis of osteomalacia and osteoporosis with ease, and then you can intervene.